Okay. Okay, so it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. And right now we're just getting our first look inside the shoulder. This is your biceps tendon here on the left side of the screen. It looks pretty good, but when we get down to the insertion, you can see it's torn here. We've got some torn labral tissue. This is where the biceps tendon normally inserts. And so this gets a fancy name when it's torn like that called a slap lesion. So we're going to do a biceps tenodesis. We're going to start with a spinal needle and a shuttle relay. But the first step is to take this spinal needle and pass right through the biceps just like that. And so we'll pass what we call a super shuttle right through that needle, and then we'll take a grasper here, great. And then we're going to take one of those tapes right there. And this is how we secure the biceps initially so that we can reattach it later. So come over here. You gotta stay with me. Okay. I mean up here, just because I'm gonna be handing the camera off to you a bunch. Here you go. Okay. Careful there. Yep, you can come a little bit closer. Let me see one of those. Yeah. I think that's got it. I can't tell. No, maybe not. That's got it for sure. All right. White balance kind of sucks, doesn't it?
It didn't white balance.
It didn't? Oh, okay. So, yeah, not quite yet. Hold on one sec, though. Let me get this, and then we'll do it. Crap. Grasper, I need another relay. Please. Got it. Okay, when the relay, I'll use that. So see what I'm doing here, Molly? So I'm going around behind the biceps. That's what makes it what we call a purse string stitch. Purse, like a purse? Yeah. Which means like the more you, like, you know those bags where you, like when you go to the beach or something and you, yeah, when you pull the bag, the strings and it closes the top. Same concept. Yeah. So it's the easiest yet strongest way to do it, but you don't have to go through the biceps a whole bunch of times. Now we'll see if I can do this. Getting there. I'm just going slowly. That tape is just a little bit thicker than a normal suture. But I'm better than the tape. So see, now it's going all the way around like that, see? So, I know. That's because they don't let you guys watch other that's because they don't let you watch other companies' consultants. Okay, so what were you going to ask? I'm sorry. Okay. So next I'm going to do the same thing with that other suture, only I'm going to pass it across that partial tear in the rotator cuff. Okay, recording. Okay, so what we're going to do now is pass a little marker stitch across this partial tear in the cuff. A little bit more anterior. So one stitch right there. To do that, we're going to take a relay once again. Hold the camera there, please. Just right there. And then I'll need a grasper in a minute. Grasper? Yep. And now we're going to load that with the same kind of suture there. Okay, and so now we're going to get on the other side of that partial tear. That looks maybe a little much, but not bad. So when we tie that, it's going to do that and seal that over. Just want to make sure I'm getting far enough posterior. I like that a little bit better, so we'll do that. Okay, so there's our ripstop stitch going across that partial tear. Again, we're going to use that as a marker stitch until we know for sure what the cuff looks like on the other side. So now we're going to finish inside the joint and go up in the subacromial space.